And here he comes now. We have enough room to actually demonstrate it?
Yeah.
Yeah, okay.
Yeah, I think so.
Got it?
Yeah. Morning, everyone. So as Pat mentioned, I'm Gene Brusso. I'm on the board of directors for TRAZER, and I'm one of the managing partners of the activity. So TRAZER is firing up right now. So what TRAZER does, just very briefly, is it uses skeletal tracking technology and locks onto 25 points on the body from head to toe. The measurement constructs, it reports currently within 3 millimeters of movement, or 1/100th of a second. The new version, which is actually going to be released on Friday, actually brings the measurement constructs to within 1/10 of a millimeter, which is obviously remarkable. TRAZER itself has different protocols. So we have a senior health protocol. We're currently putting together a fall risk assessment that comports to the CDC's STEADY protocol. So that'll be up and running in about a month. Senior health, we also have fall prevention. So the fall prevention activities incorporate balance, mobility, and cognitive awareness. And it uses, what it does is it runs seniors through different protocols to help stabilize their muscles, their joints, and also help with that cognition with regard to reaction time, responding to unplanned stimuli. The concussion management protocols include a baseline test. So the baseline test itself includes both balance and exertional protocols. So what we do is we do the best test, which is called the balance error scoring system. So what you do is three different balance activities. You do a bilateral, unilateral, and then tandem balance. And then it goes into exertional protocols. So the graded test 30, what happens is you're moving in 8 different vectors. And as you're moving through these 8 different vectors, you're responding to unplanned stimuli. The heart rate is elevated throughout the protocol. So you start moving at 1 foot per second, and then every 30 seconds, the speed increases by an additional foot per second. Lateral speed, we do a lateral speed drill. That's essentially a cone drill, only in a simulated environment. So what you do is you go back and forth to the cones, and what we're doing there is we're isolating the limbs to identify asymmetries in movement. And then we do a linear speed drill, just exploding backward and forward, right, to increase the heart rate. Then we do a jump 360. So the jump 360, you stand in place, and then you jump like this, and jump like this again in the same direction. You do that 10 times, and that's to exacerbate the vestibular system. And once you're done that, then it goes directly into another balance test. So we have the pre-exertion and post-exertion balance test, which you can compare and contrast. And if somebody has a vestibular issue or still has lingering effects of a concussion, then we can identify that very quickly. Orthopedic rehabilitation drills. So we have assessments. So we have what's called the vector test. And then we have the vector test without a jump. So if somebody has a knee injury, hip injury, they've just replaced a joint, for example, have an artificial knee, then we exclude the jumping test. We have different protocols. We have an ankle rehabilitation. All the rehabilitation protocols follow a 6-phase cycle. These were developed by Cleveland Clinic experts. So it's very, very analogous to what you would do in a physical therapy office. So for example, if you go into knee rehab phase 1, these are the activities. You start the activity, and then it runs the patient automatically through all of these activities. Everything is cue-based, so if you don't complete an activity correctly, then it doesn't count as a repetition. For people that don't like to use rehabilitation in a can, if you will, so if you want to deviate the activities in individual PT clinic, an orthopod's office, whatever the case may be, every movement pattern that we have can be set to the individual. So for example, in the lunge, right? If you go into the settings area, what it does is you can modify the activity either by time or by volume. So you can have sets, reps, and whether you want to have a rest in between. You can also adjust the movement control. So if you're training somebody to move to the right rather than to the left, you can simply turn off movement to the left. You can also control the forward movement and the down angle. So the factory default is set to 30 inches out when you're doing the lunge, and 6 inches down. But if you want somebody to go 8 inches down, you simply just go in here, change it to 8, and then you hit save settings and play and the activity begins. And it's locked into that individual's profile until such time you go in and manually change it. So whether you're doing performance enhancement with an athlete or doing rehabilitation with an individual, it locks into that individual profile. We also have a different number of assessments. So for the balance, I've already described the BEST test, the balance error scoring system. That's primarily used for first responders, military, things like that, athletes. And then we have Balance 2, which is used mostly for the general population. It's a little less restrictive. And Balance 1 is more for that senior population. The Balance 1 also allows us to do some of the activities that are contained in the CDC study protocol for fall risk assessment. I'm going to demonstrate the BEST test so you can see how that works. So when you go into the screen, it provides the instructions and an example of what the activity is going to include, how you position yourself. So it comes up, so you'll notice the blue dot, right? So it provides instruction on the bottom. It says stand in the center to calibrate. I don't have to stand in the direct center to calibrate. The machine actually calibrates to me. I just need to be in a position where it can capture me. So you'll notice there, I put my hands on my hips, put my feet together. Three, two, one, it calibrates within 3 seconds. And you'll notice how the blue dot went to the center. It also identifies the miss. So you'll see on the bottom where I take my hand off my right hip, it identifies it. Same with the left. If I take a step, it also identifies that that activity. When you're complete with the exercise, you go over here to the BEST test report, right? And then it'll identify the distance and sway, and it will also identify the number of misses that happened during the activity. And then it provides a comparison contrast previous activity with the current activity and identifies degradation in red or improvement in green. And it provides it as both as a measurement and also percentage of change. Now you want me to do like a graded test?
That would be great.
All right.
Thank you.
So what I'm going to do right now is called an Agility 90. So the Agility 90 is a 90-second exercise. And what happens during this exercise is I'm going to respond to unplanned stimuli moving as quickly as possible in 8 different directions. So this is me, I'm the avatar. So it's using skeletal tracking technology presently. So any movement that I make, the avatar mirrors. So I go back to this circle, it counts down, and then once the activity begins, bumpers pop up, and I have to engage the bumpers as quickly as possible. So while you're doing those activities, when you complete, it provides a report, right? So this is called the compare report. So what it does is identifies the current period and compared to the baseline. It defaults to the earliest baseline. Ideally, you want to have a healthy baseline to have that recovery point established. But you can track anybody throughout the activity. So if you look at these numbers here, right, I'm going to go in and select a different baseline. And you see how everything changed. So I can compare and contrast from any previous point. So whether it's performance enhancement or recovery, you can look at that any earlier period, compare it to the current period. And then identify in a stoplight report, degradation or improvement, red again, degradation, green improvement. And it provides it as a measurement and a percentage of change. The vector report shows movement patterns. So what's important here is you've got the red, which is the current movement pattern, and blue is the previous movement pattern. It also identifies asymmetries in movement here. So once you identify that asymmetry in movement, then you can take preventative or mitigating action to overcome that asymmetry in movement. So whether it's a soccer goalie that responds 30% slower to the left in reaction time, or somebody recovering from an ACL injury, it can track that over time, get them back to the point that they need to be to return to play. Oh, I want to show one more thing. It also provides a history report. So if you want to, so in all the previous reports, you're comparing the current period to the previous period in time. But in the history report, what it does, every time you complete an activity, it date timestamps that activity and then plots it out in the form of a graph. So whether you're an athletic trainer, a physical therapist, or an orthopedic surgeon, you can very quickly see whether the person's improving or degrading as they're going through recovery, or if they're using it for performance enhancement in athletics, you can track and see if they're improving, staying the same, or degrading. It's critical for use. A lot of D1 level football programs are using TRAZER right now, using the specific activity as part of their strength and conditioning program. They can track the athletes over time and then identify overuse or overtraining syndrome as well. Pat, was there any additional activities you wanted me to cover?
Well, maybe just another rehab, like the squats, where you
Oh,
have
sure.
Yep. Some of the other icons that you'll see as you're exercising to make it really easy for you to achieve maximum performance.
Right. So what I'm doing right now is I'm going into the knee recovery protocol. So as I mentioned, everything is cue-based. So what I'm going to do, the first activity is a squat. So instead of the bumpers coming up like it did in the previous activity, what it has is what's called a squat ring. So it's essentially a yellow band that goes around the midsection. Again, this is me, so it's counting down to begin the activity. So you'll see the yellow band, which is the cue for the squat ring. So when you're going down, as I mentioned, it uses skeletal tracking technology. So if I don't go down far enough, the squat ring doesn't disappear. So I have to physically go down to the point that's programmed into the system to make that repetition count, and then I return to the upright position and the squat ring reappears. So as you're going through this activity, right, you can see the movement, the squat ring disappears, right, and you also have better rehabilitation because somebody's completing it correctly. So in this case, if the squat ring's programmed to disappear when I go down 8 inches, so if somebody's looking at you visually, it's only a guess, right? I think that's about 8 inches. But with this, you physically have to go down that 8 inches to complete that activity. If you don't, it doesn't count as a repetition. So you're really challenging yourself during your rehabilitation rather than a physical therapist pushing you to complete that activity. So you have better outcomes. With this one, it's a different cue. So these are lunges, I believe, or mini lunges. So this time you're going to see a blue diamond that goes on the floor. So you'll see it in front, so I have to complete that lunge. Same for the side, right? So until I complete that activity appropriately, the cue does not disappear, right? And then when you're done, and you'll notice in this activity, it started me out on the squat, and then it took me right into the lunge. So each of the recovery protocols takes 12 to 15 minutes, depending on what the activity and what phase of recovery you're in. And then when you're complete with the activities, it provides a report, so the clinician can very quickly see if you're improving or degrading via the stoplight report on the side. The other thing it does is it reduces administrative time because all of this data goes into a cloud and generates a report. So you can go into the cloud, grab that report, and drop it straight into the EMR. So from a productivity standpoint, And return on investment, you can see more patients today because your administrative time has been reduced greatly. You also don't have to continually observe the individual and write down the information, then go to the MR and program it in. Pat?
At Hopkins yesterday, they were just uber impressed. And what we noticed there, considering the status of that hospital, was that very, very little high technology. This is way and above anything that's out there. When you go in, their eyes are going to be as big as quarters as they were yesterday. And you're providing something that's going to save time and increase revenues. So there's really nothing else like this, I can assure you, or Hopkins would probably have it. We went to every treatment room and we saw nothing even close. So,
Yeah.
if you just want to say something generally about the benefits that you know of that maybe they might not be aware of overall of the system, that would be great.
Well, sure, yeah. So the nice thing about TRAZER is it's completely mobile. So you can mount it to a wall, or you can have it on the stand like this. So if I'm going from one clinical area to another, I can just simply roll it along. It has a large Matthews stand that complies with hospitals with regard to tipping requirements and everything else. When you're moving it around, you don't have to recalibrate it, right? Because I can move it from place to place. It doesn't require sensors. I don't have to recalibrate any measurement constructs. The system does it for you. From a return on investment perspective, there are a number of CPT codes that can be used. Along with this, we have some of them, some of the CPT codes that are widely used with some of our customers now. And of course, the telehealth CPT codes have just been elevated, and Pat and Mike can get you that information, but it's really going a long way. From a telehealth perspective, particularly Veterans Administration or rural areas, you can put this into a physician's office and you can conduct an assessment, send that information to a specialist, have them review the information and make a determination on the treatment protocols required for whatever your condition is. Let me see, what else? As I mentioned, it's mobile, so for outreach activities. So if you have a physical therapist that's in an area with colleges or high schools, they can actually take this device to a high school or a college and conduct baseline assessments. St. Mary's of Michigan is really good with that. So the neurosciences division of the hospital uses TRAZER exclusively for concussion baseline testing and also return to play testing. They don't use anything else because we incorporate the movement protocols, the exertional protocols. So from a neurocognitive and neuromuscular perspective, there's nothing like it. As I mentioned, what you're seeing right now is going to go away on Friday, and we're going to have what's called TRAZER version 6. So the reports are actually going to be upgraded, and instead of being reported as feet per second or a measurement of feet, what we're doing is we've converted it to the metric system because most healthcare providers record everything, obviously, and using metric measurements. So that's a change. Another thing that we're doing is we're incorporating a game into it, and then as we're moving forward, games are going to be added, probably one every month and a half. So we have 5 games that are in production presently. So for pediatric patients, what's going to be really critical is the kid can get in here. It's already kind of like a video game to them, but now we're going to increase the gaming experience for pediatric patients, but we're not going to have any degradation of the measurement constructs. So they can get in here, have a lot of fun with it, and the clinician's still getting critical reports with regard to assessment or recovery. Let's see, what else? Finally, the other upgrade to the new TRAZER system in TRAZER version 6, we're incorporating what's called the Eriksen flanker test, which is a cognitive assessment. So we're incorporating movement into the Eriksen flanker test, and you have to respond to congruent or non-congruent arrows, and then it'll identify the number of correct movements or incorrect movements, which will be incorporated into the concussion baseline. A little farther down the road, we're incorporating 3D math. So we're having 2 versions of that. One is going to be both. You have a simplistic math problem. In one, we're going to have 3 to 5 bumpers pop up, and one bumper is going to have the correct answer on it. The individual is going to have to move to that bumper and engage it. We'll be able to measure reaction time, speed, acceleration, deceleration, as well as incorporating the cognitive fitness of the individual. The other 3D math activity is going to have moving balls. So instead of a standing bumper that they have to engage that you saw during the Agility 90, it'll have balls that are moving in an environment and moving toward you, and you're going to have to move and engage and grab the correct ball. This will allow us to incorporate the ocular component for concussion assessment and rehabilitation as well. Pat, is there anything else you'd like me to cover in this regard?
Can we ask if anybody has any questions of Gene? Can we hear that? I can't, my computer's not picking it up.